I would knock on the patient's door and I would enter the room. I would introduce myself. My name is Michaela Kicklider. I'm a student nurse at the USA College of Nursing, and I'm going to be performing your central line care today. I would check the patient's order form and see that I'm performing routine central line care per unit protocol. I would also check my hospital policies. I would gather my equipment and perform hand hygiene. I would provide the patient with privacy at all times. I would check my two patient identifiers, Jaguar Jones. I would check the medical record number 417-6352, 417-6352. I would check the patient for any allergies and see that he's allergic to penicillin, and that matches his chart, penicillin. So next, I would assess the site over the old bandage. I would assess for any abnormalities. I would palpate around the site for any erythema, edema, or swelling. I would provide the patient with privacy still. I would gather my equipment. I would position my bedside table and also my trash can. I would perform hand hygiene, and I would move the bed up to a comfortable working height, and I would also lower the side rails and assess the patient to a comfortable position. I would next remove the kit from the packaging. I would open it and just get my mask out. I would don my mask and my goggles, and I would provide the patient with a mask, and I would help him put it on. For this procedure, I will not be wearing the mask, just so you can hear me. Next, I would put on my clean gloves. I would put on my clean gloves, and I would remove the old dressing. I would remove the dressing into the site, and I would now assess the skin around the site for any complications, and if it was indicated to get a culture, I would get it at this time. So I would then discard of the old dressing and my clean gloves. I would do a glove to glove and skin to skin. I would then perform hand hygiene, and I would open my kit. I would only touch the 1-inch border, and I would remove my sterile gloves. I'm now going to don my sterile gloves. And now I'm going to arrange my supplies, keeping in mind the 1-inch border. So now I'm going to begin cleaning the site. So first I'm going to clean it with the alcohol swab. To clean with the alcohol swab, I would start on closest to the site, and I would go in a back and forth motion, never touching the same spot twice. Next, I would dispose of this, and I would wash with my ChloroPrep. So with the ChloroPrep, you wash you use friction and go in horizontal and vertical motions. You do this for at least 30 seconds. You also, when cleaning with the ChloroPrep, you clean the central line site as well as around the site. I would then dispose, and I would apply my bio patch. And I would apply my new sterile dressing. Be sure not to touch the sterile part of the dressing with my gloves. Before I put this on, I would be sure that the site was completely dry. I would completely allow the site to dry after cleaning it, and I would remove and I would be sure to preserve this so that way I could date, time, and initial and place this onto the dressing. And now I would remove my sterile gloves, glove to glove, skin to skin, and I would clean up all of my materials. I would position the bed back to the lowest position. I would raise the side rails. I would make sure the patient was in a comfortable position. I would dispose of my garbage. I would perform hand hygiene, and then I would document the site appearance. I would document the drainage, the amount, the culture if it was taken. I would document the type of cleanser I used, the type of dressing that I placed onto the central line, and then I would also document how the patient tolerated it, and I would document the time, date, and my initials.